name is Dr. Rachel Cady. I'm an obstetrician gynecologist, and I work at Cady Regional Medical Center. I've been a clinician here for about 16 years. Vulvar pain is pain that occurs anywhere between your pubic bone and your tailbone. So I tell patients really it's anything that you can touch on the outside and between your legs. That's the vulva. And vulvar pain can be the whole area between your legs. You know, you think about kind of a saddle area, like riding a horse, that whole area, or it can be a localized vulvar pain. We know that about 14 million women at any point do have some degree of vulvar pain, so it's not an uncommon issue. And you want to really discern, is it more acute, meaning less than 3 months, or is it chronic? Is it greater than 3 months? Is it the whole vulva, or is it a localized area of the vulva? And then really go from there as far as your history taking and your exam. Vulvar pain, lots of different causes for that. And so we're going to start kind of on the outside area, the skin area. There can be a lot of skin abnormalities. Again, we talk about different conditions called lichen sclerosus, lichen planus, genitourinary syndrome of menopause. Certainly there's infection. Very commonly there'll be an inflammatory response to some sort of allergic reaction, commonly pads or incontinence. Depends, that creates kind of a chemical reaction to the vulva using soaps, things that maybe weren't a problem for somebody before. And so that can be incredibly uncomfortable for women. Very commonly, nerve component. The nerve supply to the vulva comes from our sacral nerves, the lower part of our spinal cord, S2, S3, S4. And if there's some sort of damage or inflammation to that nerve, women will experience pain in the vulva. There's also an area called the vestibule, which is a part of the vulva. It's the area at the opening of the vagina. It's the opening of the vagina, and so women will commonly have exquisite pain there. Sometimes it's acute, sometimes it's chronic, where they might say that they have incredible pain with any sort of contact, like it's provoked, if it's touched there by a tampon or intercourse or anything else, causing a lot of very significant, severe, sharp, stabbing pain. And that those women with a type of vestibulitis or localized vulvar pain will have an over nerve concentration in that area. Their tissue is fundamentally different than somebody that doesn't have pain in that area. So it's more of a nerve ending type problem, and it's significant, and it's oftentimes very amenable to treatment. Other causes of vulvar pain revolve around the muscle underneath the skin. So you can kind of see going layer by layer that sometimes people have had trauma, a lot of times from delivering a baby, and they'll have nerve or muscle damage to their vulva. Our pelvis is made up of a lot of muscles, kind of acting like a hammock around the vulva and also around the vagina. And so if there's any sort of muscle spasm type things, that'll cause a great deal of pain. The other thing too is a lot of times women are asked a lot about history of abuse, sexual abuse, and while that is unfortunately a very prevalent part of women's stories, what is known is that vulvar pain does not really relate well to a history of sexual abuse. And so if that is part of somebody's story, it shouldn't just be dismissed as being the cause of their pain. So it might be a part of it, but it's unlikely to be the whole cause. So they shouldn't just be labeled as a sexual abuse victim, and that's why you have pain. You know, it might just happen to be part of their history, but it's unlikely to be the cause of what they're experiencing. Some types of vulvar pain is provoked, meaning the woman feels fine unless there's any sort of contact to the vulva. You know, she feels fine, but anything that touches the vulva, whether it be, you know, genes, for example, or again, intercourse or whatever, then she has pain. So she would definitely know. And then for other women, it's there all the time. It's there all the time. You know, they have to be in certain positions. They have to stand more than sitting, those kind of things. And so it really would be a local, anything affecting that area in between your legs from the pubic bone to the tailbone. I should mention too, in addition to inflammation, those kind of things, we don't want to forget infections. Certainly, you know, you think about different STDs, herpes, those kind of things, but oftentimes it's not anything necessarily sexually transmitted. It can be from like a chronic bacterial vaginitis, chronic yeast infections. Those can fundamentally alter the nerve supply to the vulva, making the tissue more sensitive. And so typically women with vulvar pain, you need to really get a good history. We have some really good focused vulvar pain questionnaires. We bring in an illustration of the vulva to really try to get an idea of where their pain is coming from, trying to get a timeline from the patient as well. And as far as at the time of exam, again, we leave it to the patient. We make every effort to make them comfortable, and again, to make them understand that they're in control of the exam. If the exam even occurs in that first consult, we kind of roll with it. Oftentimes we'll use a Vulva Scope, meaning where we're looking at the vulva with a microscope, basically, for any concerning skin changes or inflammation, infectious etiologies. We'll use a little Q-tip to kind of get an idea of pain location. Sometimes we use some numbing medication as well to see did that help with the pain or whatever, just as you're trying to focus what your differential diagnosis is as far as the causes of pain. And then if we do a speculum exam, if the patient's okay with that, we use a pediatric size speculum, meaning a very tiny speculum. Sometimes we don't even do that if the patient's too uncomfortable, it's just not done. Or we'll do a gentle one finger in the vagina exam, and we use a special kind of lubricant called slippery stuff, which is not irritating to the tissue. Because for some of these women, even those over-the-counter lubricants are incredibly, incredibly painful to them. If somebody has vulvar pain, what is most helpful is to really take a look at anything that's touching the vulva. And what I mean by that is any types of soaps, any laundry detergent, any pads, those kind of things, underwear, whatever, really taking inventory of that. It can be as simple as not drying your clothes well enough that there's yeast colonized within the underwear. You know, so it really starts kind of as a diary, like taking mental note. We have some information on our Cuyuna Med website, but we also refer patients to the National Vulvodynia Association website as well, which I'm fortunate to be a clinician referral specialist as well. But taking an inventory of what's touching the vulva, a timeline, trial and error, what's been done, any interventions from prior clinicians, really bringing that, you know, just even in a little bit of a diary, one-page form, whatever is comfortable, different situations that have made pain worse, things that might have helped, and then at that point, it's my job to look at that and also just to really listen to the patient before we do any sort of exam. It's also important to know that vulvar concerns are oftentimes not a part of a OBGYN's training, and so I think really looking for somebody who is a specialist in this area, and so I happen to have a great interest in this area, but it's something that I really enjoy helping people with. Obviously, it really depends on the cause. And so again, if you take all women with chronic vulvar pain, again, a lot of times it's avoiding any sort of irritant, like an atopic dermatitis inflammatory response. It's treating those infections. It's treating any neurologic issue with that. If it's the vestibule, it's treating that specific vestibulitis, which a lot of times We'll use different topical medications to help with that nerve pain. And in more extreme cases, it's removing the vestibule itself, which is just the skin. It's not a deforming type operation at all, but it is a very successful operation for women that are just not getting any relief. And, you know, they can't even place a tampon. It's always been awful for them. Physical therapy is a big part of women that have more overactive muscle component to their chronic vulvar pain. You know, their muscles are always in spasm, and so spastic muscles produce a lot of lactic acid, and that's painful, that's inflammatory for women. So seeing a PTA certified physical therapist, somebody that really knows what they're doing with pelvic floor, is great, and we do have one such physical therapist here at Cuyuna Medical Center, and there's also some in the area as well, the Brainerd Lakes area, that we will refer people to. You want to get them in with the right physical therapist. In some cases, it's also referring for a pudendal nerve block, blocking the nerves that go to the vulva, to see if that alleviates the pain. Sometimes it's even using Botox within the vulva to help with nerve pain, just like it's done for migraine headaches and other issues. So really, there's a number of treatments. Most women improve with treatment, but they do have to understand that it's a journey, but it's not something that should just be done. Try this, try that, sporadic, hopefully this works, whatever. That's the quickest way to lose a patient. And so really, fortunately, even just within the last few years, there's been a lot of developments in vulvar pain care. And so majority of women can be helped. We ask patients just to call our OBGYN clinic. They do not need a referral from their primary care clinician. And a lot of times we will send those patients questionnaires ahead of their appointment, so that we can get as much information as possible before their appointment.